Stroke is one of Australia's leading causes of death and disability. However, we understand that up to 80% of stroke cases within Australia can actually be prevented. Now, a stroke occurs when blood flow to the brain is blocked, stopping oxygen and vital nutrients from reaching the brain. Now, a stroke can occur in two ways. The first is an ischemic stroke, and this is either due to a blood clot into the blood vessels of the brain or plaque buildup into the blood vessels that cause a severe restriction and eventually a full blockage, again stopping that blood flow into the brain. The second way is a hemorrhaging stroke, and this occurs when there is damage or a burst of the blood vessels into and within the brain. A person may even experience what's called a transient ischemic attack, which is a temporary stroke, and this occurs when there's a temporary blood flow restriction into the brain. Now, having a TIA is a significant warning sign that you are at risk of developing a real stroke later down the track. This sort of warning sign shouldn't be avoided and should be discussed with your medical team straight away. So, up to 80% of strokes can be prevented. Now, we know that the main risk factors for developing a stroke include high blood pressure, low physical activity, type 2 diabetes, and high cholesterol. Exercise can target every single one of those risk factors. We know that exercise can reduce blood pressure. It can obviously increase physical activity, reduce the risk of type 2 diabetes, and reduce our blood cholesterol levels. So it's really important that we consider exercise as a top priority for reducing the risk of stroke and those other comorbidities associated. So when we're starting exercise, it's important that we aim for just 30 minutes a day, and we can even do this in 3 10-minute time slots. If you're new to exercise or you've had a stroke before resulting in some sort of physical impairment, it's important that you talk to your doctor to discuss any considerations around exercise and to consider whether a referral to an exercise physiologist or exercise professional is appropriate. Remember, just 30 minutes a day of exercise can reduce the risk factors associated with stroke and overall improve quality of life and our longevity into the future.